What are some things that patients don't think about before in-office upper eyelid blepharoplasty? So when a patient is getting an upper eyelid lift, they're usually thinking about a lot of things such as, am I going to tolerate the procedure? Am I going to experience pain and discomfort? How am I going to do? Am I going to move too much? And they're thinking about afterwards. How much bruising and swelling is there going to be? How blurry is my vision going to be? And what the final outcome is. They usually don't think about some of the experiences that they're going to undergo in the actual procedure. And these involve sights, sounds, and smells during the surgery. So let's first go over sights. So when we're working on the eyelids in an upper eyelid blepharoplasty, the patient's eyelids are closed. That being said, as we're working, sometimes we tug on the eyelid and it may open the eye and you may see light come into your eye. That's all normal. When we suture the eyelid after we've removed skin, there's a lot of tension on the eyelid in terms of closure. On top of that, the muscles that are used to close the eye are paralyzed from the numbing shot. So it's very common to have a little gap in your eyelid as you're closing and you can see out of it. That's totally normal while we're doing the procedure. That wears off usually in about 24 hours. Some of the sounds that you're going to hear during the procedure are me talking to you. You're also going to hear the clicking of some of the instruments we use. You may even hear some of the sounds of the machine we use for cutting and cauterizing. And finally, you're going to hear a vacuum cleaner sound. That's called our smoke evacuator that suctions smoke that's produced during the procedure. Finally, in terms of smells, you may smell some of that smoke, and patients will say, I smell some smoke or I smell something, and that's totally normal. The good news is the smoke evacuator suctions most of it away, but you will smell a little bit. Those are the three things during a procedure for upper eyelid blepharoplasty that patients don't really know about until they undergo it. I'm Dr. Chris Theagaraja. I hope that was helpful for you. Have a wonderful night.